me during a day of clinical.
What is this called?
PPE, personal protection equipment.
This is a isolation card, right? And it holds your
PPE.
So whenever you see an isolation card outside of a resident room, what is a good thing for you to do?
Find out what's going on.
Right.
And then put on the switch.
Good job. So this is the charging station for your mechanical lift. So we're going to get a chance to see the mechanical lift, but in order to take care of the patient safely, you want to make sure that they have a fully charged battery in the mechanical lift. So this is the station where you would charge the batteries. And you see there are some batteries here. All right. Would you say it looks like a
Garden.
All right, this is what the tub looks like. If the resident has orders to take a tub bath, you would place that resident on this sling right here. It's connected to a lift that will lower the resident inside of the tub. The patient does need permission to get into the tub, but this is something that you can do if they have a order. This is what the tub looks like. All right. This is the washer, and so depending on where you're working, you may be asked to do some light duties and them with cleaning or washing their clothes. So this is what the washing machine looks like. It's in here with the tub. If you were to have a splash in your eye, then you would come in here to actually wash your eyes out. And then any biohazard material will also go into the linens that are in here. So pay attention to the signs while you're working. So, okay, so this is what?
The emergency exit.
That's right. You need to know exactly where your emergency exits are just in case it is a fire or some type of disaster. And then you would exit here. All right? Tell me why these plugs are red. Why are these plugs red?
It just has the power outage.
Exactly. It's of a power outage, then you can hook up emergency equipment to the red plugs. You can hook up breathing machines, things that the patient absolutely can't go without. We have a power outage. That's what that power plug is for.
That's why it's red.
That's why it's red. The white ones will not work during an outage. Over here, we have what we call the mechanical lift. Okay. How many people does it take to work a mechanical lift? Two. Okay. All right. So we talked about making sure that you have a battery in the mechanical lift so that it's working properly. And then also you need to make sure that you have the correct sling size for the patient. So if the patient is small, can you use a large sling? No, because why?
He gonna slip out the car.
All right, just slip out and they could fall. Okay, so also you also need to know what else do you need to know about the resident in order to use this sling?
The weight limit.
The weight limits. You need to know the weight of the resident and then the weight limit of the lift. So in order to see the weight limit, you usually need to inspect the mechanical lift in order to see it. And right here, what's the weight limit?
400 pounds.
400 pounds. So can you use this lift on someone that weighs 401 pounds?
No.
All right. You have to make sure that the resident's weight lines up with the actual mechanical lift that you will be using. They have a remote. All right, so the mechanical lift will come with the remote. You can lift the lift up like so. You can lift it down like so. And then also you have this bar here that allows you to open up the legs like so. And then you can close the legs. And the purpose of that is to assist the lift to get around furniture. There are brakes on the lift right here, so when it's parked in the hallway, I always put the brake on, like so. And over here. All right, so let's review the mechanical lift. How many people does it take?
Two.
All right, and then what do you need to make sure is charged?
Battery.
The battery. All right, and then also, what's important for you to know about your resident prior to using the lift? Okay. And then what about the lift? What do you need to know about the lift?
How much could it hold?
All right. How much? What is the weight limit on the lift? And what about the sling?
You need to make sure they size.
You want to make sure the sling is what?
They size.
Okay. Can you use a small sling on a large patient? Can you use a large sling on a small patient? The sling has to be appropriate. And you're going to attach the slings to these hooks on the mechanical lift when you're getting ready to use it. All right, good job. Let's go. The blood pressure machine is here, but what is this sign up here indicating? The fire extinguisher. So that means that it's going to be near, and here we are. So when we look at the fire extinguisher, we're thinking about, you should be thinking about the acronym RACE and the acronym PASS. So for the acronym RACE, what does the R stand for? Remove. What does the A stand for?
Access.
Alarm.
Okay, yeah.
All right, what does C stands for? Contain.
Contain.
And what does E stand for? Evacuate. All right. So race, we're going, R stands for which, and A stands for
Alert.
is C,
Contain.
E. All right. If we wanted to use the extinguisher, then we're going to use the acronym PASS. P stands for pull.
Pull the pin.
All right.
Aim the hose at the base
All right.
of the fire.
Squeeze.
Squeeze and then sweep. Good job. And where should we sweep?
The bottom of the bed.
At the bottom of the base of the fire. Okay. So if there is a fire in your resident's room in the garbage can, what's the first thing you're going to do? Evacuate. Very good. Good job. Now, we also need to be concerned about the fire safety plan. Where is it located?
It should be with the nurse's station.
That's right. Good job. You guys are so smart. All right. The evacuation. If you needed to evacuate, this map is showing you the way you can exit. We just saw that exit door down there. And then there's another exit door over here and stairs for you to get out, and just in case the elevator is not working. Now, in the event that there is a fire, can you use the elevator? All right. All right. So your fire safety plan. You got something to say? You got something to say? Okay.
Fire safety plan.
Right. That fire safety plan could be kept where? At the nurse's station. Good.